Anthem, Blue Cross Blue Shield. No, 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 folks. Did you see that they're saying that they're only going to reimburse for a certain amount of time for anesthesia? No, I'm going to read you what the American Society of Anesthesiologists, and of course they are opposed to it, and absolutely they should be. So apparently Anthem Blue Cross Blue Shield recently decided to no longer pay for anesthesia care if the surgery or procedure goes beyond the arbitrary time limit, regardless of how long the surgical procedure takes, according to the American Society of Anesthesiologists, which opposed the decision. So thank God Connecticut's Comptroller Sean Scanlon got involved and said, not a chance. So Missouri and New York, you need to do the same. So apparently it was in 3 states, New York, Missouri, and Connecticut. And Sean said, after hearing from the people across the state about this concerning policy, my office reached out to Anthem, and I'm pleased to share this policy will no longer be going into effect here in Connecticut. So Missouri and New York, you need to do your work, folks. And then the other thing, Sean, Comptroller, I think that as well, we need to be talking about the medical providers. Is there CMO? Is there CNO? What licensed professionals were sitting at the table and allowed this decision to happen? We hold professional licenses. No, I was a prior investigator for a board of nursing. It doesn't matter where you clock into. When you call yourself a nurse, a doctor, and it doesn't matter if you're the CNO, the CMO of, Littleville, long-term care, Sunnyvale Hospital, or Anthem Blue Cross Blue Shield. No, we have standards. There are rules and regulations that dictate our professional license, and we have to adhere to them. We have codes of ethics, so I would be asking the AG in these states to include even Connecticut, even though they reversed it, and I would be calling the medical board and the nursing board, and I would be asking, actually I'd be calling Anthem Blue Cross Blue Shield and saying, so I'm going to need the first and last name and the credentialing of the nurses and the doctors that were sitting at that table who were basically paid guns and allowing that to happen, because no. And I have no shame calling out people who don't hold up the integrity of our profession. I'm a legal nurse. I'm pursuing law school. I've been a nurse for 24 years, like I said, and people who follow me know I was a prior investigator for the Board of Nursing, and I'm about upholding the integrity of our profession, of healthcare, of safe patient care, and this is not it. Any nurse, doctor sitting at that table, how dare you? How dare you? That's greed. That is greed. Risking patients' lives. There's no rational, there's no evidence. There's no science that would ever support that decision. And that's why they were able to push back and they had to withdraw that, because this is not evidence-based science. This is grotesque. I hope there are civil suits. I don't think there can be anything criminal because, no one was harmed. But for sure, boards. Why wouldn't we report these people to boards? This stuff does not happen in a vacuum, and there are licensed professionals more often than not, and I have to believe that we're sitting at the table. They have a chief medical officer, they have a chief nursing officer, they have doctors, nurses where these decisions are made, and no, those are gross deviations from the standard of care. Shame on you, anyone who was sitting at that table and allowed that to happen. Wow. There are no words for that. So we can make change, folks. Looks like they did in Connecticut. They was hearing for his people. So, again, New York, Missouri. All right, do your jobs, folks. Do your jobs. Get that overturned in those states, folks. You can do it. Reach out to your attorney general. Reach out to your comptroller. Reach out to your representative. Just have to Google who represents me and start calling them. Letting them know, emailing them. You can leave them a voicemail as well. Part of advocacy is you got to get your representatives involved, and this is the perfect time, folks. So like, follow, share. Do your work, advocates. Let's get this reversed.